All right. Hello, everybody. Welcome to the Special Committee on Long-Term Healthcare. Today is July 31st, 2023. It is 3:03, and I'm going to call the meeting into order. Madam Clerk, can you call the roll?
Alderwoman Boyd.
Present.
Alderwoman Sanye. Christine Ingracia. Danielle Spraley. Jamie Ossel. Marjorie Moore.
Present.
Harold Broswell. Chris Beckler.
Here.
Cassandra Kaufman.
Present.
Lavetta Richardson. Cindy Jackson. Kevin Anthony.
Present.
Andrew Lackey.
Present.
Laura Barrett.
Present.
Kathleen Holmes.
Present.
Annalise Stouffer.
Present.
Alderman Aldridge.
Present.
Alderwoman Sanye.
Present.
Christine Ingracia. Danielle Spraley. Jamie Ossel. Harold Broswell. Cindy Jackson. We have 11 present.
Thank you, Madam Chairwoman. I would like to make a motion to approve the minutes from our last meeting, which was Monday, July 24th, 2023. Do I have a second?
Alderwoman Boyd.
Aye.
Alderwoman Sanye.
Aye.
Christine Ingracia.
Aye.
Danielle Spraley. Jamie Ossel. Marjorie Moore.
Aye.
Harold Broswell.
Aye.
Chris Beckler.
Aye.
Cassandra Kaufman.
Aye.
Lavetta Richardson. Cindy Jackson. Kevin Anthony.
Aye.
Andrew Lackey.
Aye.
Laura Barrett.
Aye.
Kathleen Holmes.
Aye.
Annalise Stouffer.
Aye.
Chair Aldridge.
Aye.
Danielle Spraley. Jamie Ossel. Lavetta Richardson. Cindy Jackson. 13 aye votes.
By our vote, we were able to sustain the motion to approve the minutes from our last meeting. Next, I'm gonna move to committee discussion. And before we go into our speakers, this week we were supposed to have Mr. Theo from Hillside. He had some sickness where he couldn't be able to make it. So one of our committee members who is going to speak in a future meeting is going to speak at this one, Ms. Moore from Voices. And then we will also be joined by the Health Department roughly around 3:30. But before we go both to our speakers, I wanted to give the floor to Alderwoman Boyd.
Thank you. I did a lot of, since the beginning of this long-term care committee, I did a lot of research in regards to Hillside. And as chair of the health committee, it's appalling that we are having seniors living in the conditions that they're in this building. And so the facility is under compliant inspection at this time, which includes environmental and other issues. They have had 37 health citations in the last year in regards to Hillside. They have had at least 6 complaint inspections from 6/30/22 to 7/1/22, each with multiple complaints. The number of total complaints that resulted is a deficiency practice over 3 years is 47. Penalties and federal fines, they have had 7 federal fines ranging from $650 to $119,340. Denial of payment, the most recent payment denial by Medicare was on 6/22/22. And so the fire safety inspections, a total number of fire safety and emergency preparedness citations are 13. The national average is 4.7 and the average is 8.1. Additional citations are pending and have not yet been published. Some are repeat issues related to resident care that can be found once posted on CMS website. And so I'm saying that to say it's no way that we as a city should allow this building to stay open and put these residents in these safety issues and the employees. And so I am pushing hard for them to shut this building down, get these people placed in a safe environment, and get that staff where they can have decent jobs and be taken care of. It is just so embarrassing to me, as I said, as the chair of the health department, of the health committee, to have this building still open and we're having conversations about this building and these residents are living in this kind of environment. And so these residents, the last days of their lives, they should not be dealing with rodents, bed bugs, improper care. They shouldn't be living like this. And we should be ashamed of ourselves to allow this building to keep being open. So I appreciate you, Mr. Chair, for letting me speak, but I am going to be very vocal in addressing this. I have spoken to the head of Department of Senior Services up in Jefferson City. And so I'm letting you all know that I am pushing for this building to be closed down for the safety of the residents that are living in that building. Thank you.
First and foremost, thank you, Alderwoman Boyd, for bringing that to our attention. I'm sure that would have even been, I guess, even more exciting to say the least to hear. But I want to let you know, as your colleague, if there's anything that I could be a help with, please let me know. Looking forward to figuring out, as the health department get on. We heard from the building division on what capacity they're able to work on a lot of these long-term facilities, as well as the health department and what they can be done, especially as older people, what we can do with our departments to make that possible, and potentially see what can come out of the recommendations and legislation that we can pass at this board, so we don't continue to have bad actors in our community when it comes to our healthcare facilities that supposed to take care of, like you say, our individuals in their last few days. So thank you, Alderwoman, for sharing that information. Is really important. Before we move on to the speakers, I do see a couple members with their hands up. Ms. Annalisa, I seen you first, and then I'll go to Ms. Moore.
And this is possibly something that Marjorie was going to suggest, but I was just going to say, is there anything that the Long-Term Care Ombudsman Voice program can do if there are residents that are wanting to submit, statements about complaints about Hillside to DHSS to further make sure that residents are able to have a voice about their experience there?
And I'm glad you asked that, because at the last meeting, I heard a lot of people asking questions, and I kept trying to speak. I don't know what was going on, but I was just saying what you were saying, Anise, that it's ombudsmen out here that will listen to those residents and make sure that their voices are heard. And I really don't think they're letting those people come up into their building. They're, for whatever reason, they're doing whatever ways they can to prevent the information from being put out there. And so right now, what I need people to understand, because I come from that environment and I know how the state works. And so what's so interesting is I appreciate our building division and our health department speaking on it, but this is a state issue. This is where the state of Missouri is responsible for this building. It's really not a city issue. It's good they're giving us the information, but when you have violations of that multitude, that cost, that have those many fines, that's justification to send those people to a decent place where they can live. And so they're in an uninhabitable uninhabitable building. And so when I hear the stories, it's just appalling to me, because these are these people's last days on this earth, and they should not be living in these conditions. So thank you. I think they would, that would be helpful if they allow those people or figure some way not to keep them out.
Marjorie, is there any assistance that the long-term care ombudsman can provide?
Yeah. So, and this kind of goes with what I was gonna ask or say. So the ombudsman can do a couple things. So I know that Lisa, who we heard from a while back, is in there pretty often. I mean, we're supposed to make visits 3 times a year, but she's in there more close to monthly we're working with residents. So one of the things that she gives out frequently is the hotline number, because residents are supposed to self-report. That's the ideal. But we're also reporting up things up to the state level too, through the ombudsman system. But in addition, if Alderman Boyd, or if any of you hear of residents who need help finding somewhere else to go, and especially if this building shuts down or any nursing home shuts down, that's something also that the ombudsman program can help with.
I know you all are there. It's not that you all aren't there. I know that you all aren't there or there. I think what people don't understand, and that's why I said, me coming from that environment, it's just like people in the community, they're scared to say something because they feel that they'll be retaliated on. And so that's what we run into in long-term care facilities. Those residents feel intimidated, and they think that something will happen if they say something. So we have to figure a way to make them or their families understand they can get to another nursing home that's in a safer, cleaner environment. And so, I've lived it, I know it, and I've seen them. To the point where I would ask them, why aren't you drinking water? I don't want to bother. And it's not this home, but it was a home I was in. And they said, I don't want to drink water because then I'll have to go to the bathroom, then I'll disturb the CNA. So that's the mindset of these seniors. So I just want people to be clear about this environment. It's not what people are thinking. Yeah, in most nursing homes, when you walk in the door, they have the number for you to call if you have complaints, and where you can hotline. But I'm just telling you, they're scared. And so we just have to figure a way to help these seniors to live out the rest of their life in a clean, quiet environment. So thank you, both ladies.
Thank you again, Ms. Boyd, for bringing that forward. I think that's why, outside of just members, I think this committee is going to be really important to make sure that we deliver some strong recommendations. I know at the last meeting, I'm going to get to you, Ms. Laura. At the last meeting, we talked about just an idea of what that could be structured to look like. That's still open, but how we can bring recommendations, not just locally, but also to our state representatives, especially at sessions about to start up. I'm gonna go to Ms. Laura, and then I'll go to Ms. Moore for her presentation, because I know Dr. Monty is a health department. She won't be able to be on the whole time, but she's also gonna have her staff member on eventually when she hops on. But off to you, Ms. Laura.
Thanks. I just wanted to say thank you so much to Alderman Boyd for taking such firm action on Hillside. I really feel like you've been an incredible ally on this, so thank you so much. Also, it is on the federal watch list, so I think the more that we can do, which I put in the chat, the more we can do to highlight this horrible situation at Hillside and the issues with out-of-town owners, as we've talked about before. Luxor is their owner. I think that the better. And thank you again, and looking forward to working with you more on the Hillside situation. Thanks.
Thank you, Laura.
Thank you, Laura, and ditto to that also. Alderwoman, you know I got your back in any way I can help. As the standing committee, as you say, you're the chairwoman of the health committee. I forget the whole name of it. You know, we changed them a little bit, but as these both are working simultaneously, whatever way I could be a help, please let me know. All right, I'm gonna go on to Ms. Moore, who's gonna start our discussion, and then eventually, like I say, we'll go to once our health director hop on, she'll also be presenting, and then we'll be able to ask questions. Ms. Moore, the floor is yours.
Great. I'm going to go ahead and share my screen and hope that you're now seeing a slide that says voice in big letters. If not, feel
We are.
Okay, great. Excellent. So, whoops, that was not where I want that one. Okay. My name is Marjorie Moore. A lot of you have met me and certainly heard from me a lot. I'm the executive director of Voice. We are a nonprofit organization that does advocacy for nursing home residents. We have been doing this for a long time, since 1979, when we were founded to be a contractor for a couple different area agencies on aging to provide the long-term care ombudsman program. Our mission is to educate and empower individuals and their loved ones for quality care across the for quality living across the long-term care continuum. And we do this through our ombudsman program, through our friendly visitor program, through education, and then through information and assistance. One of the things that I wanted to talk about today was about, and I'm just having trouble getting there we go. Was talk a little bit about what we should actually be expecting in a nursing home, because we've talked a lot about what's wrong in nursing homes and all the things that are going badly, but I don't know if we ever really level set to what the guidelines say a skilled nursing home should provide and what it should be like. And so that was something that I wanted to talk a little bit about today, is what we should expect when we're actually in a nursing home. So there's several different federal laws that talk about this. And one of the biggest one is this code that I have up on the screen. And it's that a skilled nursing home should provide services to attain and maintain the highest practicable physical, mental, and psychosocial well-being of each resident. And practicable doesn't mean practical. This means the highest level that we can achieve with this person. So this should be a person-centered thing. This shouldn't be a facility-centered thing. This doesn't say we should provide services that are convenient given the staff that we have on our team. A facility has to be able to provide care for all of the residents that are under its care and all of the residents that it has chosen to admit. Under this, short staffing should not be an acceptable answer as to why it's not done. Medicaid reimbursement rates also shouldn't be a reason why either. Each facility signs a contract with CMS with the understanding of what the reimbursement is and what is required. So this goes on to talk a little bit further about what a skilled nursing facility must provide. And I boiled this down to the barest essentials. And so I'm going to pop in the comments later, the actual code, so you can take a look at it. But here are some of the things that a skilled nursing facility has to be able to provide, which is skilled nursing services and specialized rehabilitative services. So that medical care piece, related social services, pharmaceutical services for that resident, dietary services that meet the daily nutritional and dietary needs of each resident. Lately, we've been hearing at Voice about a lot of administrators, both in the city and not in the city, telling family members that as a skilled nursing facility, they don't have to provide a special diet for a diabetic person or a person who is on dialysis, that it's not required. And that's just not true. If a person has a medical diet that they need, they should be provided that. And also residents' right, which we'll talk about later, requires that a resident has some choice in their meals. So now if a resident chooses not to eat their diabetic diet, that's a whole different thing, and that's a resident rights issues. Another thing is activities designed to meet that resident's interests. We want, again, provide enhance the physical, mental, and psychosocial well-being. They should have access to routine and emergency dental service. And sometimes this is done through outside services, but they need to be available. And then treatment and services required by mentally ill residents. So, knowing what kind of residents that a facility is admitting depends on what kind of shifts what this looks like. So we've talked a lot about facilities here in the city, admitting a lot of people with mental illness or things like that. We've talked a lot about inappropriate people in facilities. No matter who's been admitted, though, they need to be offered these services. We talk a little bit about resident rights. This is June. She is one of our ombudsmen. Where she went. Get back to there. But June is one of our ombudsmen in North City. She does a fantastic job. She's been with us for over 20 years, providing ombudsman services and protecting resident rights for all residents. I wanted to highlight the resident rights. And again, I'll pop the actual link to some of these in the comments so that you can read over all of them later. That this is also a federal statute, that long-term care residents have all of these rights and more on a second page. And I wanted to highlight a few of them. In a right to dignified existence, they have the right for freedom against physical and chemical restraints. So this keeps us from tying down residents. And this also keeps us from drugging residents to the point that they're submissive. It requires a home-like environment and the use of their personal belongings when possible. We had an issue a ways back where a facility had recently painted their walls and wouldn't allow residents to put pictures up anymore. So, things like that are not within these resident rights. Equal access to quality care. It is important that residents that are on Medicaid receive the same services and same quality of service as somebody who is paying via private pay, via long-term care insurance, or via Medicare. They may not receive the exact same things because they need different things, but they should have the same quality of care. Residents have the rights to refuse or discontinue treatment if they don't want it anymore, but they also have the right to request treatment that they want. And they have the right to be fully informed about the type of care that's going to be provided and the risks and the benefits that might happen. So the facility is not allowed to just change a treatment without talking to the resident or their guardian. And we just talked about this. Residents have the right to have a grievance, to call the hotline or call the ombudsman without fear, or even just talk to a CNA about a problem without fear of discrimination or retaliation. We have a couple more on the next page if my computer will let us. There we go. So residents also have access to their personal and medical records so that they should be able to understand what drugs they're being given, what people are saying about them in their medical records and things like that. And I think, plenty of us that live out in the world are often surprised by our medical records as well. Another one that's really important is assistance if sensory impairments exist. One of the things we see often at Voice is that people who are hard of hearing or deaf, or people who are low vision or blind, are not getting the appropriate services that they need to live in a long-term care facility safely. So somebody who is totally blind, if they're a Braille user, should have access to Braille, but more likely if they're an audio or low vision reader should have access to alternate formats. Deaf people should have access to interpretation or to writing utensils if needed. And then residents have the right to be involved in their financial affair, including understanding what charges that they're going to be getting from the facility, maybe for a haircut or something like that. And then right to privacy. I put this one in here and I highlighted the whole thing mainly because one of the big issues that we have in a lot of the facilities that we have here in St. Louis is we have 4 people to a room. And it is impossible to have privacy if you have 3 other people living in your bedroom. Most of these facilities don't have enough or any places for residents to conduct their business privately. When something needs to happen within their room, maybe the catheter needs to be changed, that needs to be private. And it's really hard to do in these big facilities. And then they also have finally the right to have a safe and orderly transfer. So we talked about Hillside, if that facility closes down, residents have a right to have that transfer planned out, and for the residents to really understand where they're going and what their choices are, and not just be told that they're going to another facility that's owned by the same company. They get a choice in that matter. And then they also get to come back if they go to the hospital. A quick briefing on where the federal landscape is right now. Back in 2022, CMS and the Consumer Financial Protection Board started ramping up oversight on illegal debt collection. Facilities and companies were going after family members on debt incurred by residents, which is illegal. And then at that time, and then even more so now, CMS is starting to release more information about ownership to the public, most recently with allowing us to see all of the, not kind of an aggregate of all of the fines and quality standards for all the nursing homes a company owns, which has been great. In early 2023, CMS started looking more at antipsychotic drugging and starting to post the citations under dispute to care compare. I have not seen one of these yet. They say they're doing it though. It's supposed to be out there. We'll see. And then hopefully in late summer or fall of 2023, we're hoping to see minimum staffing standards put out by the Biden administration. We've the national organization, National Consumer Voice, said last week that they were told late August, maybe sometime in September. So we hope to see that soon. But that's going to make Missouri a long way to go, because as we most recently found out, Missouri's now at the absolute bottom of the pile as far as hours of resident care per day. So Missouri is going to have a lot of work to do to catch up to any minimum standard that gets set. So I'm happy to take any questions. I know I probably went a little bit over my time, so
Also, you was perfect on time, Ms. Moore, so you're good to go. Very helpful information. I do see a question from a hand raised from Mr. Howard.
Hey, Marjorie. That was great. So, I mean, it's interesting because, like, I guess, well, everyone else has two questions. I have two questions. Okay, so one, I guess, to me, it seems like, the laws seem pretty good. Like, there are actually good laws. Are there things that you would change about the laws? And if so, what is one question I have. And two, so assuming that there are at least some good laws there, it seems like there's an issue with, enforcement of them, or actually kind of bringing them into reality. And I'm curious about what you might have found to be the political obstacles about that. Do you feel like voice? Yeah, like, so what? Yeah, maybe just that. Like, what is this an issue that you feel like legislators down in Jefferson City or more broadly are interested in? What groups are opposed to the kinds of enforcement that we're talking about? And how supported do you feel politically in voice?
yeah, so so there are several laws I would change. Obviously I'd love to see a minimum staffing standard. I think the biggest problem is that there are a lot of ways to get around a lot of what's on here. If these laws were followed perfectly to the letter by everybody, facilities would be pretty good. But we found a lot of ways to get around them. And especially resident rights. I think, those are the ones where, if we really truly provide care that is person-centered and follows all of these rights, nursing homes wouldn't be somewhere that people don't want to go. They would be places that people would feel more comfortable with. But funding is an issue. funding is an issue, I think, for the ombudsman program, for the state surveyors. And then also, there are certainly a lot of problems with Medicaid reimbursements on a lot of levels. They get real complicated. We've touched on that a little bit, but then that money gets sucked out of the system. So that's messy. I would also, I'm not sure I'd say I'd ban related party transactions, but I would really want to look a lot more closely at them on a national level. As far as who's opposed to change to this, I would say that the big one is the nursing home lobbies, the American Healthcare Association, Missouri Healthcare Association, and also the Assisted Living Association. I'm not sure exactly what their initials are. Leading Age is the Nursing Home Association for nonprofit nursing homes. They tend to agree with us a lot more. We don't, but I would say that they are generally more pro-resident than the Healthcare Association tends to be. And what gets in the way, I think, in Jeff City and at the federal level is money. Both of those lobbies, the Healthcare Association, the Assisted Living Association, have a ton of it, and they spend it a lot, and they're there every day. I mean, Voice during session hopes to have our staff person down there every other week for a couple of days, because that's what we can afford. But there aren't a lot of other big resident advocates. Most advocates are out there advocating for nursing homes. I think I answered all your questions, Harold. If not, remind me.
That was great. Thank you.
And Annalisa said, talk more about resident rights. I could talk about those all day, but.
Oh, that's what I was gonna say. If you want to share, I know Dr. Monte's on, but if you do want to share, I was talking this whole time on mute. I'm like, she's saying exactly what I'm saying. No, if you want to talk a little bit more about that, please, I want to give you the floor also.
Yeah, so resident rights are really what the ombudsman program is built on. So if those of you that didn't see it, I think to go back to listen to Lisa Smith's presentation, probably back this winter. She's an ombudsman that actually does the work. I'm just her boss that makes sure that her check gets signed. But it's really what this program was built on. Back in the 70s, shortly after Medicaid and Medicare came online and started paying for nursing home care, it became really quickly apparent that there were going to be abuses. And so these are things that were put into law to make sure that nursing home residents lived a dignified existence. And that's really important, to make sure that they're living in a place that's safe. They're able to express themselves either positively or negatively. That being able to contact your ombudsman, that's one that's in there and specifically called out, is that they're allowed to call the ombudsman at any time, without a phone card, without their cell phone. They're supposed to have access to a phone to call the ombudsman, whether they're paying for it or not. And that's really important. So, that's what our program tries to do, is uphold those rights. It becomes really difficult though, because we are seeing more and more understaffing of facilities. So, a resident right is, to be able to shower and bathe and have their personal hygiene kept up. But when the facility doesn't have enough staff to make sure residents are bathed twice a week, sometimes once a week, sometimes longer, it becomes really hard. And those are things we advocate for. We get really loud about, because we think it's important.
By any chance, are you able to share that PowerPoint to the email, so we could just add that to the drive? So as we do come up with the recommendations, we always can lean back on that for helpful information.
Absolutely. And Annalise points out that Voice does need volunteers. We need volunteer ombudsmen like June. And we also need friendly voice volunteers who are people who go in and just do friendly visits. They're not there to uphold resident rights, but sometimes just having somebody to talk to makes the world a lot better place.
If folks want to volunteer, how could they figure out how to volunteer for Voice?
So they will go to our website, which is voicestl.org/volunteer, and I'll pop that in the chat as well.
You're the best. Also, I want to give Ms. Moore a plug, one of our members. If you haven't seen it, the St. Louis Public Radio, I was about to say St. Louis American Public Radio put out a great story today about called Missouri Among the Worst in the Nation for Hours of Care for Nursing Home Patients. And Ms. Moore is in it from Voices, just talking about some of the issues we have in the state. And I know Ms. Laura put that in the chat. So please read it, please share it. It is a good article to check out.
Thank you. Thanks, everybody.
No problem. Thank you, Ms. Moore. All right, I'm gonna turn it on over to our fabulous, I always have to give her a shout out. Dr. Monty is our health director at the city of St. Louis, the health department. She is just all around amazing. She does a lot of great work. One thing that I love about Dr. Monty is she's really changing what healthcare looks like in the city, being very more hands-on, also ensuring that we reach people in communities that we haven't in a while. I mean, if I continue to talk about her, we'll be here forever. So I know she's have a very important presentation she wanted to provide with us, as well as her staff member on, and then I know people will have questions. So I'll save her all my flowers for another day. But Dr. Monty, before I actually turn it over to you, Dr. Monty, Ms. Moore, one thing that I forgot to do, if you're willing to raise your right hand and say everything that you just said was the truth, the whole truth, and nothing but the truth. Do you swear that everything that you just gave to the committee was the truth?
Yes, we do.
I appreciate that. Dr. Monty, are you there?
Yes, I am.
I know you'll be talking, and then I think one of your staff members, Justin, will be talking. If both of you guys, before you start, could raise your right hand. And do you guys swear to tell the truth, the whole truth, and nothing but the truth to the Special Committee on Long-Term Healthcare?
Yes, I do.
And I guess when Justin come on, I'll get his affirmed. But I do want to turn it over to you, Dr.
See your face.
Oh, are we able to see your face or just hear you say that, Dr. Monty?
Can you see my face?
No.
So I see my face. Hold on.
There we go. So one more
Yeah, so
time.
I'm on two different windows because I need to call in on one and be.
Okay, well, while I got your face, if you could just raise your hand and say, you swear to tell the truth, the whole truth, and nothing but the truth. I'll take that as a yes.
Sorry, can you hear me now?
Yep, you swear to tell the truth, the whole truth, and nothing but the truth.
I do.
Awesome. The floor is yours, Dr. Monty.
So real quick, somebody kicked me off the second screen I was on. Understandably, I understand why, but I was at a meeting late. I apologize. This is me trying to make this work for this committee. So I'm on site at a site visit, and the laptop they have me using can't let me share slides. So you know what? Let's just forego the slides to make life easier.
I was gonna say, do you need to log back in? We could make that happen.
Yeah, it'll just delay things and I'm not computer savvy. So you get to see my face and not slides. I thought the slides would help with background, but thank you so much for the invitation. It is wonderful to join this committee. I'm not sure if Justin Hauser has joined us yet. He was waiting on the.
You just went muted, Doc.
So I'm not sure if Justin Hauser has joined yet, but I'll try to separately see if he could join. But it's wonderful to to be on this call today. My name is Dr. Monty Tachwayo Davis, and I've been the Director of Health since October of 2021. You know, I wanted to make this more of a fireside chat and Q&A, but if there is background around the current infrastructure of the health department and the scope of the work we do that would be helpful, please let me know. Otherwise, I would be more than willing to take questions. By way of background, I do know that you all have had some discussions with the building division, and there's intersections between the work they do and the work my department does. So happy to start from that juncture, or if there are things that folks think would be helpful. I'm willing to start there. I can't see the chat from here, so I'll need people to verbally let me know what their questions are.
So far, no questions. Dr. Monty, yeah, so far, no questions besides you spoke at the voice conference too.
I did. That was wonderful. Marjorie, I think that may have been you because I think you're the only person who would know I spoke at voice. But I just, COVID really made the rest of healthcare go to the wayside. And I think one of the vulnerable populations that we're all aware of are the aging and the elderly. And I just want to shout out the incredible work and leadership that Marjorie and her office does, as well as Department of Health and Human Services. The health department, and I made slides for y'all, so I'll make sure they get sent to you. We unfortunately, most cities have a combined health and human services department. So one of the things that I think we struggle from a capacity standpoint is to be more collaborative than we are. But the work of the elderly and the aging is focused mostly through Department of Human Services, DHS. But from my standpoint as the director of health, our long-term care facilities are pivotal in the care management and advocacy of that population who are disproportionately impacted across healthcare indices. And we saw that especially true during COVID, where throughout COVID, we saw disproportionate impact of COVID, of hospitalizations, and certainly of death in this population, especially in spaces and small spaces for which infection prevention measures were flailing behind what we were learning, right? And that caused these incredibly high risk environments, not only for the population we were trying to serve, but for the healthcare heroes who are also operating to support this population as well. So I saw something pop up in the chat, but again, I can't open it. So Alderman, if you could read me the question.
I'm not the alderman, but I'm happy to read it.
I could read it for you,
Okay,
Dr. Monty. It says from Laura.
You want
would
to
love,
read what's in the chat?
yeah, would love to
Okay,
understand.
I can read that.
Okay.
Would love to understand how, someone mentioned that you spoke at Voices Conference, Dr. Maddie. And then also would love to understand how the health and building division tackle a situation like Hillside.
Yeah, so again, just want to see, can anyone tell, or if Justin is here, Justin, if you could unmute if you're here?
I am on the call, Dr. Marty.
Okay, great. So I'll get started and then Justin, I'll punt over to you. And is everybody hearing me okay? Just some head nods would be helpful. Perfect. So there is no formal practice process specifically for long-term care facilities. So my bureau chief, Justin Hauser, who oversees our environmental health bureau, that includes our community sanitation officers, are often called to calls that range the gamut of public health or healthcare concerns. And if there are specific ordinances or legislature from a city perspective that cover that, then they are empowered to get involved, but that is not always true. So there isn't a one size fits all of how we work with building. It really is on a case by case basis. So Justin, if you could give like a brief overview of, first of all, just confirm or deny if I told a blatant lie to the committee, which I hope I did not, but also just in general, how you see community sanitation addressing the scope of the issues that the Bureau sees.
Thank you, Dr. Mahdi. Good afternoon, everyone.
Can you hear me?
I can. You're coming in a little broken, though,
Okay.
Alderman.
If you can, if you could just raise your right hand first, I can swear you in and then please answer that question.
Certainly. I don't have my screen mirrored, though, so you'll need to take my word that this is, in fact, my right hand.
Do you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Go ahead, Mr. Justin. You can proceed.
Thank you very much, Alderman. I think the main distinction to make here in this situation when it comes to environmental health is where our jurisdiction lies. So if we're discussing a state licensed facility, that's going to be a situation where the Department of Health will not have jurisdiction and where we would coordinate with the state and our partner agencies. If it was not a state licensed facility, if there were maybe long-term apartments or residents at a facility, then we would have some jurisdiction when it comes to the typical community sanitation violations that we cite for and gain compliance. This would be defective plumbing, insect infestations, interior concerns like that, and then exterior concerns concerning rats and things. So I think the main determination and distinction to make is if the facility in question is a state licensed facility or not. Otherwise, if there were apartments or there were long-term residents, then the normal workflow for the Department of Health would come into play, where we receive a complaint either from a tenant or if there was a mandatory reporter that had identified an issue, we would then dispatch an inspector who would conduct an investigation. And then based on the results of that investigation, we would look to abate an issue. We would look to issue a violation notice that could escalate depending on the responsible party's participation, whether or not the issue was resolved, but we could end up with a court referral and fines in that situation. That's the brief overview. I don't want to just ramble on if there's a more focused discussion that needs to take place. So I'll yield at this time and turn things back over to Dr. Mahdi or to you, Alderman. Thank you, everyone.
Yeah. No problem. Thank you, Justin. We actually got a few people with their hands up. Not to jump anybody. I know Ms. Laura had asked a question in the chat and your hand is up. Did you have a follow-up at all, Ms. Laura, before we go to the other panelists?
Yeah, I guess my question would be, so considering the fact that Hillside is licensed by the state, did you guys actually, when you heard all the, we definitely called in some complaints to the health department about the bed bugs and all the plumbing situation at Hillside. Did you guys end up doing an inspection there, or what ended up happening at that facility? That would be really helpful. You didn't get to hear Alderman Boyd's testimony earlier, Mr. Hauser, but she was saying that the problems there are just absolutely still unbearable, and it's a really sad situation. So love to hear how that, how you sort of have to handle that because of the law, but then also any suggestions you might have or any thoughts that you're bringing to this committee, because this committee is really thinking about how do we change things, how do we kind of mix it up. So anything that you and Dr. Mahdi would suggest would also be super helpful. If we just had this one tool, it would make a whole bunch of difference. That would be great to hear from y'all. Thank you very much.
So by policy, we're not in a position to provide like inspection details without a sunshine request and a formal process. So I'll ask Justin to provide as much detail as we're able to on a call like this. And then I love the idea of us being able to work collaboratively to talk about some of the things that I know Justin and his team aren't empowered to do, because I think the frustration on this and on multiple things within the city is the fact that they're multi-departmental issues. And for this one, health has one part of the puzzle, but certainly does not have an enforceable arm or runs point on decisions of this nature. Justin, want to make sure I'm not speaking out of turn and kind of hand it to you to discuss surface level what the approach to something like Hillside would be.
Thank you, Dr. Mahdi. I think what I hear is the ask for what would help. And so I think if I was going to provide some insight on what would help a situation like this, I think oftentimes our inspectors run into challenges where individuals that are the occupants are unable to kind of meet their end of the bargain when it comes to a property owner or a landlord that wants to treat. Before a pest control company can come in, occupants need to move certain things away from walls. There's certain things that need to take place, and based on age or mobility challenges, that sometimes just can't take place. And so if there is a landlord or a property owner that wants to treat, if there is a pest control company that's identified to conduct the treatment, but that last missing piece of the puzzle is the occupant is either not physically able, they don't have the resources, or there's just some other barrier that prevents the actual effective treatment from taking place, I think that's the other component, that resource or that assistance would help some situations so that we could have properties treated and the issues resolved.
Are you good, Ms. Laura?
But to also be, and thank you, Justin, I couldn't agree with all of those suggestions. But Ms. Barrett, to be clear, yes, an inspection was done. Yes, those are always documented. And then yes, those get passed on to the other, that once completed, the other divisions that are involved in the multi-departmental nature of these things are also informed, if that makes sense. For our portion though, what Justin outlined are some of the barriers and the issues are the reality of the scope of what we can do. Is there a follow-up to that? And did we answer the question as you had hoped? Yes. You're muted, sorry.
That's good for now. I think also just in the future, let's think together about how to create tools that are going to make you guys' job easier and make the city, the long-term care situation a lot better than it is now. So just like really encourage folks to brainstorm and dream about that.
Thank you, Laura. I did see, I want to say, was it Miss Annalisa? Did you have your hand up first before Mr. Andrew? Then I'll go to Mr. Andrew.
I'll just jump in with a short question. So I'm the director of the St. Louis Area Agency on Aging. We're part of the Department of Human Services with the city, and we are mandated reporters. So when we hear about cases of suspected abuse or neglect, we have to report it to DHSS. In my experience in working with other departments in the city, it's also helpful when we share information with other departments. If people, when they're doing Citizen Service Bureau reports, if they can provide pictures, if they have residents that are prepared and willing to speak to inspectors. Sometimes it's difficult to gain access to a building if you don't have a person that you're coming to see. If there are issues of sewage or elevators being out of order, those are also things that could be reported. Is that correct?
Can you repeat the last part of the question? So it was a long list. So are you asking if all of those lists are things that they can report?
I'm just saying kind of that it's helpful if you have pictures and if there's a resident that's willing to speak to you and if there's some assistance to gain access to the building. And then maybe, yeah, sorry.
Yes, the more that our inspectors can help based on the nature of the situation, the better for us as well. The inspectors have been trained according to state standards as well. And they're very thorough. So when I review when these inspections come across my desk, they're very detailed. They have pictures to accent. And so yes, anyone that has that type of information when speaking to them, the more that we have at that level is really helpful.
And can you say anything about the kinds of fines that you're able to fine buildings that are having issues and whether that moves owners to change the situation? Or is that more building?
Annalisa, this is Justin. So there are a few violations that the Department of Health has the jurisdiction to cite and do the notice of violation letters for, and then potentially refer to court. The majority of those are for defective plumbing, or if there was an insect infestation, whether it happened to be bed bugs or cockroaches. Those are going to be the top two complaints that we are going to submit the notice of violation as well as the potential court referrals for.
Okay, thank you. And I do just want to say that when we partnered with the health department in the past, you guys have been very responsive. So I appreciate the work that you guys are doing.
Thanks, Annalise. We love a positive feedback moment.
Next time we go to Mr. Andrew. You got the floor, Mr. Andrew.
So yes, thank you. I have I think two questions. One is pretty short, and I think so. From what I gather from your presentation is that long-term care facilities that receive Medicaid funding would not fall under the jurisdiction of the city health department. That would be exclusively the jurisdiction then of the the state health department? Is that would be my first question. And then something that came up at the discussion with the building division last week was that would it be beneficial to have a formal process or channel if there was a building complaint that came in and the building inspector as a part of that inspection notices a health issue, what they might suspect is a health issue, would it be helpful if there would be a formal process for that for that building division inspector to forward that on to the health department? So those are two questions. So thank you.
Mr. Andrew, this is Justin. So for the two questions, the first one regarding state licensed facilities, you are correct in that would be a referral to the state agency. The Department of Health would not have jurisdiction. Oftentimes our inspectors will show up and then the facilities kind of know the routine and we will not be allowed access to do the inspection because they understand that they're licensed by the state. So that would be a referral from the Department of Health to the state for those inspections for facilities that were licensed by the state. The second part, there may be room for a more formal connection. There is a collaborative work group that meets monthly between building division, city councilor's office, problem properties. So we do communicate monthly, kind of on a informal work group format. So there's a potential for a more formal group, but there is communication that currently goes on discussing the type of collaboration you had mentioned. Thank you.
Any other questions or follow-up questions from the members of the committee to Justin or Director Dr. Monty from the Health Department? If not, seeing none. Oh, one hand came up real quick. Ms. Laura?
Sorry. Yeah, so I guess I was wondering, Dr. Monty, are there other states that are doing this differently around giving the city any more power on, entering the building in terms of especially long-term care? Have you heard of any best practices that you'd recommend to us that might be helpful on this?
Not offhand. Casually, I will say that different cities, counties have different legislative processes that give them stronger or weaker abilities to have, legislation is one thing, but enforceability is another thing, right? I will say that the fact that the health department hasn't been involved in clinical services for, I think, close to 10 years now, and I could be wrong with that number, doesn't help. It doesn't put us in a strong position to be involved in any sort of interventions around clinical care, and those are handled by the state. And our absence from that arena also means that by extension, we're not really at the table for meetings, updates, and things of this nature, right? The state doesn't really feel compelled to keep us involved as they shouldn't in matters that have to do with clinical care. And I see this in other platforms as well. When I think about convening, I used to be a part of a meeting just observationally around all the CMOs in the city, but there's no real need for the city to be at those meetings because we don't provide clinical care. So I think it depends on the legislative process, how clear they've been around enforceability and around enforcement past that, as to whether the impact work actually makes any sense. So in order to really have a robust conversation around that, I think we would need to do a deeper dive into what other cities are doing, which we haven't yet, but I'd be happy to be involved in. But also to have a conversation, this committee may be interested in also speaking to the city councilor's office around what the scope of legislation and actual enforcement is as it pertains to this. Justin, anything to add there?
No additions, Dr. Mati. Thank you.
So I really appreciate the opportunity to be invited here today. It is great to hear where this committee is and the sort of things you're looking at. I hope this provides a more clear, I have a great working relationship with the esteemed alderman and Alderman Sonia. And I remember when former Alderwoman Ingracia was talking about the formation of this committee. So it's beautiful to see all of your faces and the level of involvement. What I love about these sorts of invitations is that they continue an organic relationship around bidirectional questions and thoughtfulness around process. So please keep me informed. I'm happy to come back. If there's homework that you have for me specifically before we meet again, happy to attend to that as well. But hopefully this was helpful. I think it should make you aware of how flawed the system is, as are most systems at city and county levels as they pertain to this work. And so there's a lot for us to do here and a lot of potential for impact, especially in removing some of the silos in which this work is done.
Well, first and foremost, I want to thank you, Dr. Monty, and also Justin for being here. And I always appreciate your willingness, Dr. Monty, to just be honest and transparent, being a director of the city, not to throw under the bus. But I think one thing that even myself and Alderwoman Sonia always says, as we learn in the city as new alder people, you find some things that are antiquated. And I'm sure members that have also been serving as well have the same struggles, but I always appreciate your honesty, but also willing to figure out how do we get past that. So I'm sure if this committee has any questions as we get into our recommendation point, and if we need to ask you any questions and follow up to try to figure out where those breakdowns are, we'll definitely be reaching out. And I know you're always just a phone call or email away. So thank you so much for your leadership in the city, and thank you for being here today.
Absolutely. Thanks for having us, folks.
Thank you. Thank you. All right, committee members. So as we are still in discussion, a couple of things I want to kind of put on our radar and go into an open conversation really quickly before we adjourn. So next meeting is August 7th, of course, same time, same place, 3 p.m. Zoom. I know at one point me and Ms. Laura was talking about trying to schedule an in-person meeting, maybe at SEIU. Just leave that out there. I would love to. I've been honored to be able to work with City a short time and see you guys on Zoom. But we have one more meeting, and I told you guys to keep that following Monday on your calendars, because we have some speakers like Mr. Theo from Hillside, who was sick today, who couldn't make it in front of us. Some speakers that wasn't able to come last meeting, like Mr. David Smith, that was pointed out by a member. So I would say between August 7th and the following Monday. Hopefully that following Monday should be our last meeting, but I'm going to try to see if we can try to in-person meeting if people are comfortable with that. So keep that on your radar. 2 more meetings, and then we'll be having, of course, more conversation of trying to come up with a report and the review. Put all our meetings together in a document so we can see what that looks like. As well, if we have any follow-up questions, I will be definitely willing to reach out to any department that needs to be brought in front of us. The second part of it is I want to have an open conversation with everybody of who still needs to come. So we do have 2 meetings. I know next week we're supposed to hear from Mr. Howard. You have a guest, correct, that's coming next meeting?
Yeah, you mentioned him, David Barden Smith. That's him.
Okay, so Mr. David is coming, and then the other person that was on the list that I'll be reaching out to is Mr. Sam Brooks. That's supposed to come the following week. Outside of that, there's what I roughly have is 3 other people that may be the other meeting. If I'm missing somebody, please somebody jump in and let me know. Mr. Theo, so I work with Ms. Moore to figure out if we can get Mr. Theo either in potentially next week to try to squeeze in 3 people, or the following week, whichever works for his schedule. Definitely willing to accommodate him for the committee, and also to let the committee know ahead of time to make sure I respect your schedule. And then we have Mr. Sean, a suggestion, Mr. Sean, the St. Louis Public Admin who works for the city, definitely willing to bring him forward. Something that I just thought about in this time that I think will really be important as we think about recommendations that we bring forward that Dr. Monty mentioned. I think it'll be important to potentially bring the city councilor Sheena in front of us to look at as we one thing that I've noticed in my short time at being the board of alderman and to my colleagues, please jump in, or even Alderwoman former Ingracia, is sometimes we have ideas of what legislation look like, but we do forget about that enforcement, who can enforce it. So I don't think that would be a long conversation with the city councilor, but as we are trying to come up with ways to make the process a lot more easier in the city with recommendations, I think it'll be good as we bring recommendations forward to the board that we just get a weigh in from the city councilor, as she does speak a lot on a lot of pieces of legislation. So like I say, next week we do have Mr. Howard's guest, as well as I'll be reaching out to Mr. Sam. Ideally, if Ms. Moore get back with me on Mr. Theo, I'm willing to accommodate him to try to have 3 speakers next week. If not, the following week, as well as following week, we'll try to squeeze in Mr. Sean and the city councilor. Is it anybody that I'm missing from the conversations that need to be, or a speaker that need to be brought in front of us? Ms. Moore, I see your hand up.
Yeah, I'm talking to her tomorrow, but the family council president of St. Louis Altenheim, which is a facility that was nonprofit last year and was sold to a corporation, has started to see some significant downfalls, is interested in talking with us too. I just have to talk to her tomorrow to let her know what she actually would have to do before she commits.
And what's her name again? Because I do remember you putting in the email. We talked about it.
Her first name is Mary, and I will have to get back to you on her last name.
Okay, if you could, if she is able, I would say that last meeting, the Monday after the 7th, if she would be able to come in front of the committee, that would be helpful.
Perfect.
Am I missing anybody else that's important? I mean, it's a lot of people that's important, but that the committee would love to potentially have come in front before we move to our recommendation stage.
Do you want me to reach out to this gentleman, Barbour, Barbour, who wrote this book about private equity and wrote an op-ed in the New York Times about nursing homes in particular and how central they are to private equity companies' business models, to see if he has any ideas about local enforcement? I mean, maybe I could ask him beforehand, and then if he does have ideas that would be worth presenting, I could then invite him.
Yeah, I did see that individual that you brought up. I think if you are able to, not saying that it's not probably worth them coming to front, if you're able to, one, also share with the committee, so that we can dive into it. And if people want to have a deeper discussion on what he wrote about, absolutely willing to allow him to come in front of us. So if you could please share that his work to everyone so that we can kind of take homework on it. And if people have deeper questions in it, definitely would, if the committee want to try to squeeze them in the next 2 meetings. Thank you for that reminder, Mr. Howard. Any other folks at all? Going once, going twice. Okay. As we move on to only announcement I have is I do want to also again echo to all members, please, if you haven't checked it out, it's in the chat. I've kind of lost it since my computer went out, but I read it earlier. Please check out the St. Louis Public Radio article on the Missouri among the worst in the nation in healthcare. Our nurse, one of our own committee members was in that, Ms. Moore, and I think it's just a good read to read and also to share, to put out there to the committee. And Laura say that we're happy to host either meeting. So that's something I'll be talking with STL TV. That's where it get a little complicated. If we move from not the Board of Aldermen or on Zoom, what that may look like for spacing. So that's a ideal hope. If it does happen, ideally it would love to be the last meeting where we all can potentially meet in person before we move to the recommendation stage. But I have to do my homework on that first. But I do appreciate that, Ms. Laura. And then Ms. Annalise also had put the article in the chat. So everyone, please check that out. Any other announcement from any other committee members? If not seeing any announcements, only other announcement I have is I will continue to echo. I'm just honored to be part of this meeting and doing the work with a fabulous group of panelists. I really do appreciate it. And so with that, I would take a motion to adjourn.
So moved.
Is there a second?
Second.
Seeing a second, all in favor, aye.
Hi.
Oh, or actually, Madam Clerk, how do we remove the motion? Or can we do that?
Repeat that.
I forgot to do the excuse members that's not here. There was a motion on the table with who did the second?
I wasn't here for that. Tracy?
Whoever second, would you be willing to remove your motion to adjourn?
Remove motion to adjourn.
Okay, I hope I'm doing this right. Clerk Shap supposed to be here to check me on it, but Madam Clerk, could you excuse all the members that was not present?
Will do.
Now, can I have a motion to adjourn?
So moved.
Is there a second?
Second.
All in favor, aye.
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 Seeing none opposed, motion is meeting is adjourned to next Monday. Thank you all and can't wait to see you next Monday. Have a happy Monday and a great week.